Hello, this is Dr. Bob and Debbie DeMaria once again with a half-off health program. And tonight, we have been anxiously waiting to present this program to you. It's about memory care. You know, you've heard of Alzheimer's and you've heard of dementia, so let's just put them all together in memory. How many of you have forgot where you placed your keys? How many of you maybe are driving along and wondering, where are you going? I know right now that so many of you are watching me and concerned you're going to literally lose your mind like your mom, your grandmother, or even a close friend. You know, recently I was at an event and someone said something to me that one of my high school classmates has been diagnosed with Alzheimer's. So, you know, Alzheimer's is a German name. It came from a physician back in the early 1900s because people were starting to have some challenges and they were literally not remembering. Your brain is made up of fat and it's made up of water. And really, the jury is still out of the exact cause of memory loss, Alzheimer's, and dementia. So what I would like to do today with our conversation with you is to help you get a better understanding of how your brain works, how your nervous system works, and why are we seeing an epidemic of Alzheimer's and memory loss today. And the reason that we bring up the word memory care is because that's really the new buzz today. When you go to a facility, they talk about having memory care because I know that some of you are very concerned about your family members and what you're going to do for them. And what I would like to do is explain to you how the nervous system works and how the brain works and how it impacts you and what's going on day to day. This is a spine. Your brain sits in the skull. The brain continues on as the cord. The cord is inside of the column. What you eat, very important, what you eat impacts your body. What you put on your skin is absorbed into your body. The air you breathe, the water you drink. Stress is devastating. So let me throw out a few items to you right now. Do you have white spots on your fingernails? Do you have large pores on your face? Men, do you have pain on the inside of your heels? Do you have blood sugar stress? You might be saying, Dr. Bob, what are you talking about? Those are common body signals for a zinc deficiency. So I'm going to throw out an awful lot of little nuggets, little body signals today that you need to wrap your brain around. Lack, or when you have white spots on your nails, it's a body signal for a lack of zinc. Now write this down. There's a part of your brain called the hippocampus. If you can't say hippocampus, just remember hippopotamus. So if you're having conversation with somebody, you can say there's a part of the brain, I can't really remember, but it sounds like hippopotamus. The hippocampus is a part of your brain for memory. Guess what it needs? Zinc. Really, Dr. Bob? Yes, and I just gave you some body signals for it. Large pores on your face. Do you have scars that don't heal? Are you always sick, healing slowly? Guess what depletes the body of zinc? Wheat and soy. So number one, you need to have adequate zinc. Well, in our practice, and for those of you watching me anywhere in the world right now, you can go to our website, druglessdoctor.com, and you could take what we call the aqueous zinc test. Anywhere in the world, we could send this to you right now, and you could take a test. And if you have a deficiency of zinc, you need to incorporate it in your diet. It has been estimated that 1/3 of the women in the United States today have a deficiency of zinc. Very serious. You know, Deb, the whole memory issue, it just impacts everybody, regardless of what socioeconomic level that you're in. Anybody can have a memory challenge.
Well, I know, Dr. Bob, you were discussing about the food, and you did just discuss that about the zinc deficiency with wheat and with soy. But I'm going to ask you a little bit something else too.
Okay.
is yesterday it was reported that people with diabetes have a greater chance of losing their memory. So where's the correlation there, Dr. Bob?
Well, Deb, I'm so glad you brought that up. You see, zinc helps your body make insulin. Okay, so let's really have you all start thinking a little bit. People who are diabetics actually start to have reduced blood flow. They can have reduced blood flow to their brain. They can get gangrene. But also, Deb, people who are diabetics with the altered insulin have inflammation. So you could literally have inflammation in your brain that affects the blood flow. So there are so many reasons for a person to have memory challenges. So yes, diabetics definitely have the potential to have that. But there's even something else that I want you to really grasp and put your brains around here, because we've talked about brain, we talked about the spinal cord. Now this is just a visual of a large wire. Your spinal cord is a wire. Now listen to this. Your brain sends messages on a layer of fat on this wire, and it's called the myelin sheath. The myelin sheath is the name of the material that's around and on top of a nerve. So let's stretch it here a little bit, because sometimes people, they don't want to take responsibility, Deb, today for their health. And I know that what you eat is either going to promote or take away. Hippocrates said, let food be your medicine and medicine be your food. Well, this happens to be a container of trans fat. And what really bothers me is if you look at this package really close, it says 0 grams trans fat right here. But in the nutrition facts, it has partially hydrogenated oils. Well, you may say, Dr. Bob, who really cares about that? Well, I care about that a lot, because we impact people worldwide. And one of the 7 books that I've been really fortunate and blessed to write is Dr. Bob's Trans Fat Survival Guide. And in this book, we have a chapter on Alzheimer's, and we have a chapter on ADHD. The physiology is the same. What do you mean? When you consume a fat called trans fat or partially hydrogenated oils, that's common even in breakfast cereal. So what I'm holding in my hand right now is a bag of breakfast cereal. I need you to become label savvy, because if you see something on the nutrition facts that says trans fat or partially hydrogenated oils, it impacts in a negative way a fat in your brain called DHA. DHA stands for docosahexaenoic acid. Docosahexaenoic acid has everything to do with your brain functioning optimally, because your brain is made of fat. So here's something else that can cause memory challenges: trans fat or partially hydrogenated oil. So we've talked about 2 items already. Lack of zinc. Debbie mentioned diabetics have a greater chance to have an issue with that. And the other item that I just told you is trans fat or partially hydrogenated oils. If you're consuming that right now, it's going to impair brain function. And I'm really serious. You really need to evaluate what's going on. And don't say, oh, my auntie had Alzheimer's, or my Uncle Louie had dementia, and because they had it, I'm going to have it. If you're eating and you're doing what they did, I guarantee you, you probably will follow the same pattern.
Wow, Dr. Bob.
I know. It's amazing,
You know what?
isn't
I
it?
want to summarize just a little bit. Okay?
That was a lot.
Well, it was a lot, but one of the things that people need to know is just what you said, the pattern of ADHD, the pattern of Alzheimer's or memory, and the pattern of actually depression all follow what we're talking about right now.
I know.
So it doesn't really matter one of those types of things. So you've given us so much here. Give us, I think, to simplify us, for us, tell us, 1, what can we stay away from other than the trans fat? And 2, what do we incorporate in to help us? Because obviously we have to eat something.
Well, Debbie, you bring up some very good points. And I want you to write this down. It's D, Delta, Harry, Apple, DHA. Because Debbie and I could talk to you for hours. I need you to go to my website, druglessdoctor.com. I just want you to go to a search engine and write down DHA fat and start to analyze that and study that because it has everything to do. So we need to have proper fat metabolism in your body. You may wisely think about getting these two books, Dr. Bob's Trans Fat Survival Guide. Debbie made a very interesting point. Dr. Bob's Guide to Stop ADHD in 18 Days, because in both of these books, especially this ADHD book, we're going to tell you exactly what you need to eat so you have the proper formulation, the proper gathering of the food items to make DHA in your brain. Always remember this, trans fat sabotages DHA. What I'm holding in my hand right now is a container of sugar. This is how much sugar is in a 12-ounce can of soda. Now, hello, I'm telling you right now, I have patients that come in, I ask them if they drink soda. They don't drink 12 ounces anymore. They'll drink 20-ounce bottles, 16-ounce bottles, 24-ounce bottles. I have people that'll drink 2 or 3 liters. Makes me sick, Debbie, just thinking about it. The soda. So that means if you drink 3 sodas a day, 36 ounces, which is about a little over a liter, you're getting a half a cup of sugar. You're going to say, Dr. Bob, so what does that have to do with memory care? Now listen to me. Sugar depletes the body of B vitamins, zinc, magnesium. Those nutrients are needed to make DHA in the brain. So if you have a mom or dad at home and the memory is starting to fade. Now, I have personally witnessed this by going into skilled facilities that help people that have memory challenges, and I have not been able to figure this out yet, but they give people in nursing facilities, Debbie, sugar almost every day. And see, what sugar does is it robs the body of nutrients. I mentioned B vitamins. If you do not have enough B vitamins, you could literally have raw nerves. Now, B12, in our practice, we do blood tests. It's called a CBC with a differential. I can literally send you a kit anywhere in the world to do an assessment of a CBC. It stands for complete blood count. Write this down. We are looking for your MCV, mean corpuscular volume. Your MCHC. You can see, Dr. Bob, you're talking a foreign language. No, just write it down, because if those blood cells are large, that means you have a greater chance to have poor oxygenated blood, which is going to impair function and reduce memory. We're going to take a short break, and we'll be right back. Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to our Half Hour of Health program. And tonight, for those of you that have just tuned in wisely and by the grace of God, we are talking about memory care, and it is epidemic. They estimate millions of Americans over the next decade or so are going to be challenged with memory issues. And we are addressing that. So you might want to go online and type in Dr. Bob DeMaria Memory Care and look at this particular video. We're focusing on 2 different books tonight, Dr. Bob's Guide to Stop ADHD and Dr. Bob's Trans Fat Survival Guide. And the reason that we're talking about those particular books, because those books have the physiology of a fat in the brain called DHA, docosahexaenoic acid. But I want to share a couple other thoughts with you when it comes to memory loss. We have the ability to take a sample of blood out of your little finger, and we can send you a kit to do this. And we're doing what we call essential fatty acid blood spot testing. We're looking for DHA, so wherever you're at, anywhere in the world, we can send you this kit. And if your DHA level is low, we have to supplement accordingly. Also, in that same blood test, we're able to determine if you have adequate zinc or not. Something else that I've been blessed to learn over time. We do many different types of tests in our office, and we can do something called a mineral tissue hair analysis. It's like doing forensic medicine. We grab hair, or we don't grab hair, we take hair, or you would take hair from the back of your neck, we send it to a lab, and we have an assessment done to minerals in your hair. Because see, what you eat impacts, and at one point will be in your hair. A skilled healthcare provider, when they analyze mineral tissue hair analysis, can literally forecast 4 or 5 years out what's going to happen to you. Oftentimes, we'll see low zinc and high copper on a hair analysis. I know when somebody has high copper, their brain has static electricity in it. But I'm going to share something with you, a little known secret, and that's one of the reasons that we write books is, on the hair analysis, when we see low sodium and low potassium minerals, it's a body signal to me that you may have exhausted adrenal gland function. This is what I've learned in my over 30 years experience of being a drugless doctor. When somebody has depleted adrenal gland function, I always see high aluminum on their hair analysis. You heard right. When I see adrenal gland exhaustion, I see high aluminum. And there are some healthcare providers that believe that high aluminum is the reason that people have Alzheimer's. That's just one of the many factors that we have been fortunate to discover over time.
Dr. Bob, we need to break that down. And the reason we need to break that down is because people don't really understand, how does your adrenal gland get exhausted? Why is your adrenal gland function down? What causes that? All right?
Well, the adrenal gland is a pair of glands that are located on top of your kidneys. And I've mentioned already several times about sugar. Sugar depletes your body of minerals. Your adrenal glands, when they are strong and they are really effervescent, they will push unwanted, unnecessary minerals out of your body. And one of them happens to be aluminum. A lot of you watching me right now have stress. Actually, if I was to have a wave of hands right now of how many people are stressed, we would probably have a little mini tsunami throughout the world, because 80 to 85% of you watching me right now have stress. Stress also negatively impacts the adrenal glands. Here's something else that we have discovered. We have been doing testing. Yes, our office is a research facility. And you know, you can evaluate a brain. It's called an EEG electronically. And you can evaluate a person's heart electronically. It's an EKG. And yes, you can evaluate nerve function. It's called an EMG. Well, we also have the ability right now that we can evaluate your entire body. We use something called a galvanic skin response. It's literally asking your body electronic questions, electronic signatures. It's a galvanic skin response, much like a polygraph, or commonly known as a lie detector. We could have you put your hand on a cradle that's literally plugged into the software that we've been fortunate to develop and do an assessment of your body. Once again, wherever you're at in the world, we could literally send you one of these hand cradles. You could plug it into your personal computer. We could do an assessment, send you the information. You say, Dr. Bob, what does that have to do with memory care? Well, what I've been learning and I've been blessed to discover over time, we are seeing an increased amount of arsenic. Yeah, you heard that right. We're seeing increased arsenic in our patients that we are treating personally that have memory care issues. And if you want to help prevent long-term memory issues, between the mineral tissue analysis and the galvanic skin response, for just a little bit of an investment, we could literally turn your whole life around. And this is very serious, because do you know how much it costs to live in a facility today that has memory care? Anywhere from $3,000 to $6,000 per month. They'll take your house, your firstborn child. I'm just joking about that. I am serious about the $6,000 a month. So those are just some of the items that we see. Now, another item I want to share with you. that most people don't realize. Digestive aids, proton pump inhibitors. I'm not telling you to go off of medication, but I've done a lot of research on memory care, and what I have learned is that people who use digestive aids, digestive drugs, proton pump inhibitors, Nexium, Prilosec, etc., they have poor digestion, poor protein metabolism that impairs brain function. Do you know that some of the medications that you're on right now can impair function of very important organs and tissues in your body? And probably one of the most important organs in your body happens to be your liver, which is this visual for an oil filter, and that this liver is very important for optimal fat production in the body. Your liver is the storehouse for vitamins A, D, E, and K, so your liver is important for fat metabolism. But I want to throw out a few food items to you that I'm going to encourage you to start consuming on a regular, consistent basis. I would like you to consume at least 1 tablespoon of flax oil per day per 100 pounds. You would be very wise to do the essential fatty acid blood spot that I mentioned to you. In our practice, and you can go to our website, druglessdoctor.com, we use a product called Bio-Omega 3, which is anchovy and sardine-based oils. Those are very important to allow that fat in your brain called DHA to be produced. I'm going to also encourage you to consume a food called the avocado. Yes, the avocado has a protein in it called carnitine, which is very important for cognitive thinking and behavior. You know, so many times people come into our office and they want to take something. Everybody wants to take vitamins. You've heard of the herb ginkgo biloba. It's a great herb. We can make that available to you. It helps increase blood flow. But your real key is we have to reduce inflammation in your body. So I'm going to encourage you to minimize sugar, minimize trans fatty acids. Those cause inflammation. They reduce blood flow. I would like you to write this down also, and I will spell it for you. There's a product or an item that we use called nucleozyme, N-U-C-L-E-O, nucleozyme, Z-Y-M-E, forte. It's RNA and DNA, and it's a product that we have successfully used in our practice to help improve memory. We also use a product called Cytozyme B. Cytozyme B is sourced from lamb tissue, lamb brain as a matter of fact, and we've also used that to help create the glandular support, the cellular nutrients that you need for optimal brain function. So, water is so critically important. See, the brain is made up of fat. The brain is made up of water. There's so many items that I could share with you. I would encourage you to get Dr. Bob's Trans Fat Survival Guide. That's going to help you understand how to make DHA in your body. I'll go over a couple other thoughts with you. If you have large pores on your face, that's a zinc deficiency. You may contemplate getting the aqueous zinc test. Minimize wheat, soy, and sugar. Wheat, soy, and sugar deplete the body of zinc. You may think about having the essential fatty acid blood spot test done. We could literally send you a kit anywhere in the world. That'll help me help you forecast and create a system, a strategy to prevent memory loss. Think about having a hair analysis. The hair analysis itself, the mineral tissue analysis, is like having forensic medicine done to your tissues. And significantly what we've been finding is been using the galvanic skin response. It's a hand cradle that we could literally send to you anywhere in the world. And you could work with us. You can call the number on the screen for more information. It's 1-888-922-5672. That's 1-888-922-5672. Or send an email. Go to my website. My goal is for you to have as sharp a brain that you have in your twilight years, in your 80s and your 90s, that you did when you were 10 or 15 years old. It has to do with what you're putting in your body. Make sure that you get plenty of sleep, drink your water, start memorizing Bible verses, exercise your brain. Go to the book of John, John 16, and Jesus told them that the Holy Spirit will give you remembrance. My prayer is that your faculties will be with you to the end. Give us a call today. I promise you, you'll be glad you did.